Fire Garden, thoughts on officials distributing N95 masks to the public in the interim for office workers and mass transit users. Again, major debate around that. If you look at cultures, several cultures in the Orient, Japan and China specifically, as well as some others, have always, for decades, used masks. In the Western countries, you don't see so much of that. Now, there was a cardiologist that started doing some deeper look at use of masks. He went into his hospital and noticed so many healthcare workers that didn't have masks and were walking around the hospital without them, and concerned about how many of them were breathing and exhaling coronavirus. He actually made a pretty good case that we should probably, in the West, reconsider that custom of not using masks. Whether he's right or not, I think remains to be seen. Here's the other side of that debate. At a time when we're putting the healthcare workers into harm's way, throwing them into a battle and killing them, and they're dying because they're infected with coronavirus, because they have inadequate protection, I would agree with the other side of that debate that, look, you know what? Let's make sure we protect our healthcare workers who are standing in the ER waiting for the next COVID patient to come sneeze on them before we start doing these routinely in office workers.
Well, and our healthcare workers, our emergency personnel, and our yet not to be named emergency personnel, the grocery workers that are essential.
Our son is a grocery worker.
So I think we have to get the personal protective equipment to those people first.
The healthcare workers need masks, but you can make them with t-shirts, vacuum cleaner bags. Yeah, there's been a heck of a lot of innovation that's gone on. The face shields as well as the face masks. We still have some activities going on with that testing program that I've discussed a few times. One of those activities is involving several different groups actually buying Tyvek material, the house wrap material, from Lowe's and other hardware stores and taking it to cottage industry, small Kentucky-based seamstress companies, and they're making those gowns out of Tyvek house wrap. So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs. We go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.